yellow or yellow-green. And then abdominal distension, bloating, vomiting. Symptoms of bowel obstruction or volvulus. So treatment, surgical, of course, surgical correction. We need surgery para matarong ang intestine to its proper place. And then resection of affected bowel if volvulus occurs. Next. So imaging modality, upper GI series, TRAPS contrast through duodenum, identifies abnormal course of duodenal flexure. So it is used barium enema to determine cecum's location. And then sonography for imaging modality, position of the duodenum, and SMA. So here is a picture para makita nyo ninyo unsay difference of normal anatomy for the intestine and then malrotated intestine. So as you can see sa normal anatomy, it is well coiled and move na siya, di ba? Sa ato ang makita is we study this one. And then sa malrotation, look at the small intestine and the cecum. Supposedly, the cecum is straight siya sa left side. So, murag nagka-twist sila sa small intestine. So, muna siya ang malrotation. So, wala na siya sa ilang proper place. Next is Hirschsprung disease or congenital ganglionic megacolon. So it refers to the absence of neurons, Meissner and Ehrbach autonomic plexus in the bowel wall, typically in the sigmoid colon. So in this disease, there is nerve cells na inside our intestine na ay nerve cells to help move our poop. In this disease, there is no nerve cells, so meaning missing ang nerve cells. So it can because of that, poop can't move, causing severe constipation and swollen belly. Dako ang belly. So causes the absence of ganglion cells. Absence of ganglion cells. In the distal colon due to failure of migration of neural crest cells. Signs and symptoms. Delayed Niconat passage, abdominal distension occurs, nagoy abdominal distension kay dili makamove atong poop, so bloated jud. And then severe constipation, recurrent clinical infection, risk of toxic megacolon. And then for treatments, surgical resection of ganglionic portion and temporary colostomy, staging surgery. Imaging modality used barium enema, dilated proximal colon, narrow distal segment, and position. So next, congenital and hereditary anomaly is Meckel diverticulum. It is a congenital diverticulum of the distal ileum. This sac-like anomaly is located within 6 feet of the ileocecal valve and is a remnant of a duct connecting the small bowel to the umbilicus in the fetus. So, there are Meckel diverticulum. Siya isang flight. So, nagtawon ninyo sa kuan na pit haning sa may small intestine. Small intestine. Sa normal anatomy, wala siya pointed something sa ilalong. But sa metal sa verticulum na siya ng sac-like or anomaly located within 6 feet of the elliptical valve. So, ang causes ani kay congenital remnant of the fetal white line, speed persistence of the connection between ileum and birutin. So when a baby grows inside the mother, there's a tiny connection between the belly button and intestine that's supposed to disappear before birth. So if it doesn't disappear, ano siyang magnaing sac-like or kanang something pouch sa elliptical valve. Sometimes it causes bleeding or infection in the belly. So signs and symptoms, yes, recurrent bleeding, perineum, terminal region, vomiting, and obstruction. Caninic appendicitis. Then next, imaging modality, nuclear medicine, Beckle scan. So technetium 99 is used here in nuclear medicine. So peritoneum, uptake, and gastric mucosa. So radiography, often normal use for obstruction symptoms. So by the way, treatment ato is surgery. Katong sac-like o pouch, it needs to be removed. So next is gluten sensitive enteropathy. So what's gluten? What do you think? What gluten is? So ang gluten, muna siyang protein found in a bread, pasta, and cereal. So Kaniya disease, it is formally known as celiac screw or celiac disease. It's an autoimmune hereditary disorder involving increased sensitivity to the glycine fraction of gluten, an agent found in wet barley and rye products such as bread, which interferes with normal digestion and absorption of food through the small bowel. So, gluten sensitive enteropathy, it is also called celiac disease. So, some people's bodies cannot tolerate or cannot handle gluten. So, when they eat such food like gluten, their small intestines get damaged and it becomes hard to absorb nutrients. They may feel tired. So, of course, you'll feel tired, have diarrhea, bloating, or lose weight. So, next. So, causes of celiac disease, autoimmune reaction to gluten remedy, to mucosal damage, and bilious atrophy in the small intestine. So, signs and symptoms, katanglingon, diarrhea, flatulence. So what do you mean by flatulence? So it is too much gas in our stomach or intestines, causing burping or farting. And then weight loss, anemia, malnutrition, calcium, and vitamin deficiency. So treatments, gluten-free diet, of course, it's from the word sensitive, so kailangan of free from gluten, and then